Okay, so now you know how to document labs, you know how to create your opportunities for your clinicals. So now we're getting into scenarios. Your EMT, AEMT, and paramedic class will all have scenarios in there. Scenarios are going to be documented under the Platinum Planner side once again. So you'll go in through Platinum Planner, click on your student account, and just like you created a clinical under opportunities, you will also create your simulations that you did under opportunities. So once again, we'll click My Opportunities and we will click Create Opportunity. So unlike before, your opportunity will look a little bit different. It's still a student-generated opportunity. However, this is a sim lab or whatever your instructor advises that you call it. So say you have a simulation lab and you have a patient and a scenario. Now, under class, you are going to choose paramedic or EMT, AMT simulation class instead of before when we were doing clinical field experience. Now you're going to be doing simulation. And under site, you will always use West Georgia Tech. And your category is going to be simulation center or lab. Like I said, location's always primary. And your preceptor is going to be your instructor. Once you have created this will look like an opportunity, but it will be a simulation. And it will show up separately under your completed skills. So once you do this, you're going to submit just like before. I already have one of these, so we're going to go back and open it up. So once you submit your simulation, it will show up exactly like a clinical. So here we are. It'll look just like you're documenting on a clinical because technically your simulation is supposed to be treated as a clinical, like you are treating a patient in the field any other time you would on a clinical. That is what the simulation is for. So like I said, you'll have your overview and it'll look just like this. It'll show where you're at. Like I said, it'll show you where you're at on the map. And then you'll have your category now will be simulation or lab. Your class will be, like I said, the simulation class. So just like before, you'll go to info. If your preceptor, which is your instructor, is not available, you can just add them just like you would a preceptor. So if your, say Tom is not in here, you'll add him. After that, your your instructor will be in here and you can use him again. Like I said, choose from the list, find your instructor. If he's not there, create a new instructor. This part right here, it really doesn't matter. You can put your instructor if you need to, but it's going to go to them anyway, regardless. So this is not something that you have to do unless you're just being over the top extra. Like I said, here you go with your simulation number 1. So we're going to come down here and you'll have patients, just like you would if you were doing a clinical. So patients here are the exact same. Nothing is changing. You're just adding a patient just like you normally would. Your patient type now is going to be simulation. Everything else will be exactly the same. If you are in paramedic school, simulations are a capstone prerequisite. If you are in EMT school, it is a competency. And if you are in AEMT school, it is a competency unless your instructor advises that they're doing a capstone prerequisite. This would only occur in the event that we were COA accredited for the AEMT class, which is probably going to come soon. But that's what your exposure will look like. Age group, whoever you have. So we have another 41-year-old female. And Your pathology. So here are your sim requirements. Mine look a little bit different because they're geared towards the paramedic program. But you'll have pathologies based on the simulations that were given. Like we can pretend this was a cardiac arrest sim requirement. Like I said, you're always going to want to click successful, or else it's like you never did it. And then just as before, you're going to do it just like a regular clinical. And it is, once again, very important that you have this EMS patient care report on here so that you can do a PCR. Once you click on these skills, they do not add down here unless you click successful. So say you established IV access on your cardiac arrest, and hopefully you did chest compressions because that is what should be done on a cardiac arrest. And if you put in a supraglottic airway, or if you just bagged your patient, you're going to want to add all of these skills. Once you do that, you are going to save it just like normal. Once it is saved, it will look exactly like this, just like it would in a clinical, and you will come down to your forms. And your forms are going to be the exact same as a clinical. You can evaluate your instructor. They will get all of your feedback. Like I said, be honest. If you did not like the way that I or whoever your instructor is created this simulation, put it sucked or whatever you feel like. And then rate the preceptor, and then pretty much just fill out all the information that you can. After that, you'll go down to your PCR just like before. It's a simulation, but you're going to want to go ahead and fill out the form, and it looks exactly like a PCR from a clinical. And you are going to go through, and just as before, you're going to include all the information that you possibly can, and your instructor should give you a pretty good amount of information. As far as all that goes, your instructor might make you keep up with your times, or they might call your times out to you during the simulation. Prior aid usually doesn't exist unless the simulation requires it. So this was a cardiac arrest. If your prior aid was the fire department stated that they gave Narcan prior to your arrival, because why not? That's what you'll put. You'll put if it changed the condition. If they're still in cardiac arrest when you get there, obviously it did not change the condition. Once again, you have your trauma criteria, trauma triage, pediatrics, symptoms, in our case, death, since it was a cardiac arrest, and then your impression, just like before, and then here's your treatment. So this is going to be the same. You're going to do any medication you give. Anything that you do needs to be documented. So medications, procedures, and vital signs, like I said, at least 2 sets. There's not very many vital signs to do during a cardiac arrest unless you get ROSC, but you still want to at least have, your glucose on here. After that, like I said, if you know that they had an advance directive from your simulation, you can put that. If you don't, then you don't. Destination, you are probably going to make up whatever hospital you choose for them to go to, or your instructor advises you're closest to. After that, you will do a full-blown narrative. Same thing. You're going to treat this exactly like a clinical, exactly like this is a real live patient. Simulations are meant to do just that. They're supposed to simulate a real call. So you are going to want to document as it is a real call. Like I said, do your narrative, fill out everything from top to bottom, whatever your instructor advises, chart, SOAP, chronological, however you do your PCRs. After that, now you're going to go to documents, and once again, it is up to your preceptor whether or not they require you to take pictures of your paper PCRs and upload them, or any other lab documents that you performed during this time, and upload them. It is going to be completely up to your preceptor. After that, you will come down and submit your documentation just like normal. Once again, you cannot get this back once it is submitted. So make sure that if you did a simulation and you only had one patient, that you've documented well on that one patient before you submit your documentation. Once it is submitted, it goes to your instructor grades it, and then that's it. All of your numbers will once again show up just like they should inside Platinum. And that is going to be how you document your simulations.